friends, it's Kelly Casperson here, host of the You Are Not Broken podcast, and I'm so excited to be having a conversation with my good friend. You want to introduce yourself?
Yes. Hi, everyone. This is Faryal Michaud, and also you're listening to Write Your Last Chapter podcast. And I love having Kelly today together, and we were going to do this differently, but I love her idea of both of us interviewing each other. Hi, Kelly. My name is Faryal, and I am a palliative care physician. I live in a beautiful state of Hawaii, and I have two teenage girls, 13 and 15, and we love living here. And I got to meet you through the magic of the life coaching. So that's kind of where I am.
Yeah, it's awesome. And you have an amazing niche. Your niche is end of life and coaching people specifically on end of life. And my niche is sexuality and all the obstacles we have to that. And merging the two in the Venn diagram of chronic illness or maybe end of life and still exploring sexuality or confronting sexuality, whatever it might be, is a very interesting intersection. So thanks for having this conversation with me.
Yeah, I'm super excited. And, it's interesting because, yes, I do care and coach people with life-limiting illnesses, but my major thing is trying to teach all of us, and why it even got me into life coaching, is living intentionally. Like, your life is short, right? Like, your life, all of our lives, regardless of whether you and I know of a diagnosis that we have right now or not, our life is limited. So going further upstream and telling people this is super valuable. And I'll share with the audience that my first guest coach that I had this year for my program was Dr. Kelly Casperson, because I think sexuality is very much a very important part of living intentionally. So I love talking to you about this today.
I think it's the definition of living intentionally. I mean, it's not all of it, but it's like to think about what living intentionally means, because I'm always curious. I'm always trying to figure out how to better explain to usually women, but men as well, that they're the driver of their life. And so many people are sitting around passively wishing it was a different way, which wishing gets you nowhere. And I think focusing it the way you said is just like the focusing on being intentional about how you're going to spend your time here is an incredibly beautiful way to think about it.
Yeah. So, I mean, I think so much of what you taught our group, and it was such a popular episode that people who didn't get to join live have watched and gave feedback. And I just thought I would love to have the audience listen to what you have to say about this topic, because, our sexuality from the time that we feel sexual till the very last day is a big part of us. And I don't want anybody to think that that's a part of them that needs to take a back seat, whether they're well or whether they're ill. That doesn't change.
And I think it's really important to define, sexuality, because I think so many people have a very narrow, limited view that they think it means penetrative sex between two people, right? And when that's your view of sexuality, it's very narrow and it gets very threatened with health conditions or lack of partner or whatever it might be. When you expand your definition of sexuality to be enjoying living on earth in your body, right? And enjoying giving pleasure to people and enjoying receiving pleasure, not just in a sexual way, but as kind of a pleasure-based body, and being driven towards, what am I attracted to? What brings me pleasure? That's where, you get woo real quick is what I say, but it's like the people who truly embody their sexuality 24 hours a day, that's what they mean. They don't mean this very narrow definition of partnered penetrative intercourse.
Mm-hmm, mm-hmm. And I love that you said that, because to me, one of the things that's very important is our idea of self, like our awareness of who we are as a person. And the more clarity you have about who you are and what you need before you get sick, the more you're going to be that person after you get sick. So what I mean by that is, if you already had insecurity, if you already question your attractiveness, your worthiness before you get seriously ill, that's just going to get compounded, because now that you're seriously ill, you feel less than even more. Whereas if you felt worthy no matter what, even after illness, even if you have 2 weeks to live, you're still 100% worthy. So I really want to start this dialogue and talk to you about You can ask your questions and I can ask my questions. So I want to approach you, if you don't mind, to talk about what has been your experience as a urologist, as somebody that takes care of, the most important part of our body. I want to talk to you about what has been your experience in terms of women with urological cancer or any kind of cancer when they come to you and they address issues regarding the quality of their sexuality having sort of taken a hit.
Yeah, I think it absolutely takes a hit for a lot of people. I appreciate that the survivorship community at the cancer center around here is starting to realize quality of life after saving a life is incredibly important. I had no idea until people started to tell me the devastating effects of breast cancer treatment, just the idea of breast cancer, how it affects one's body image, sexuality, and then relationship, and the amount of divorces that happen afterwards, either because we are not acknowledging, sexuality within that relationship, or we're not treating vulvar pain, vaginal pain, things that limit our ability to enjoy pleasure. And the fact that we're actually talking about it now and saying there's things that can be done and it's important, these women were devastated. Not only did they have a cancer diagnosis, but now their relationship's on the rocks. Right. And so that sexuality as a part of survivorship and quality of life is, I think, just starting, but it's a beautiful thing. But so that's just breast cancer. But what got me involved in sexuality in the first place was a bladder cancer survivor. Had absolutely no desire. Certainly when our body's stressed or we're receiving radiation or chemo, just body image changes that, if we defined our body as X, Y, and Z, and now it's different, right? So, and multitude of issues with cancer diagnosis can affect our sexuality.
Can you maybe also talk about male survivorship as far as cancer is concerned, regarding, like, you can maybe talk about testicular cancer or, things that you see day to day?
Yeah, the biggest one, I think, in the urology world is prostate cancer, because number one, prostate cancer is the most common non-skin cancer in men. So it's very common. And then the treatments are devastating as far as both urinary and erection function. They're getting better. Right? Surgeries today are much better at preserving erectile function than surgeries done decades ago. But I see a lot of, again, it's that people come in defining sexuality as very narrow, right? The penis has to get erect. It has to put something in the vagina. So when and that's in a heterosexual relationship, and that's not all relationships, but when any of that gets threatened or challenged, everything falls apart. All of the intimacy falls apart, right? Like, well, now I want to avoid opportunities for sex, so we'll start going to bed at different times, and we shouldn't cuddle on the couch because that might lead to sex, and so we don't hold hands. And so now all the intimacy is gone just because that narrow definition got threatened. Right. I see that quite commonly. And then, people defining themselves as a man has an erection. Well, you're still a man, even if your penis doesn't work. But it's a devastating kind of body image or even gender image that can come up with that. What do I do now? And people don't have the tools.
So this is very fascinating, because I think so many people who are listening to this 100% identify with that, because as people get older, as our bodies don't function the same way, especially with erectile dysfunction, so easily going hand in hand with atherosclerotic disease. And I remember somebody talking about erectile dysfunction in some way. It's like the canary and the what's the terminology in the mine?
Oh yeah, the canary in the coal mine.
Yeah, the canary in the coal mine. And I think that's such a good way of looking at it, is that it's just a sign of our body no longer being functioning well. But of course, if you have bad atherosclerotic disease, nobody really cares about much. But if you can't have an erection and have, be sexually able to quote unquote perform, so many of the men and also women tie their desirability, tie the quality of their relationship to something that's entirely just a physiological thing, and drama gets created. You and I both know and understand so much of this as being a mindset, and how we can think about a healthy relationship can be so many other things. That's not entirely only just penetration. But can you talk about what are the tools that people who don't have all the mindset teaching can tap into to learn about all of this? Like, what are the things you recommend to your patients?
Well, I mean, I think the first step is always just awareness of it, right? Of like, to see what you're thinking, to see what your thoughts are about, oh, I'm really making this mean something about me. The classic one is the woman making his erectile dysfunction mean something about her. It happens all the time. Like, I'm unlovable. He's not attracted to me. He's having an affair. Instead of like, oh, the penis just doesn't work that well anymore because it's 50 and it's, had some health issues. And it doesn't, it's like, I always say it's that extra 10 pounds of bricks in your backpack is like to take those bricks out, to be like, you're just adding more pain to this scenario that's you already don't know how to navigate. Right. So it's like, take off the bricks that you don't need to be on there, and making it mean something about you as a person is usually just extra baggage. As far as expanding tools for intimacy, again, awareness of, hey, my definition of sex is an erect penis goes in the vagina. Well, we've got a problem now because that's not how our scenario works anymore. Again, just awareness of like, oh, I am curious about if we can be intimate in other ways. And what a lot of people don't realize is they think intimacy comes from that penetrative act. Intimacy comes in being vulnerable, in communicating, in sharing, all of that stuff, which we never get taught how to communicate well, right? Let alone about challenging conversations like sexuality. But that's where the intimacy is, not in the actual, oh, I put something in my vagina that was his. So again, it's just an awareness of that, and to be like, what can we do to be intimate with each other that doesn't involve that?
Mm-hmm. Mm-hmm. A couple of things that you shared in our group coaching, which I thought they were so amazing. And one thing was having a conversation with your partner, and you kind of suggested having those conversations, obviously not immediately before or after, but on a walk, in a more less threatening setting. Can you talk a little bit about having the conversations about sex outside the bedroom, and what's the best way people can approach it?
Yeah, I mean, every relationship's different, right? So number one, it's like, if at first you don't succeed, it's okay to try again. This isn't one conversation. This should be a lifelong, because if there's a challenge now, there's going to be another challenge in 5 years, right? Like, there's always going to be challenges, and the better you are at talking about them, the more resilient you're going to be when the next one comes, because ultimately it will come. Being lighthearted or sharing what you're learning. Hey, I listened to this podcast today and they say that intimacy is actually created in blah, blah, blah. What's your definition of intimacy? How do you feel close to me? So open-ended questions, sharing stuff that you've learned, always work better than, why don't you ever give me an orgasm? Or, like, it's that kind of accusatory, shaming, blaming. Stereotypically, again, I see a lot of men think the woman is the problem and she just needs to be fixed. That's another big stereotype that I see. In that, a sexuality issue in a relationship, that's a couple's problem. That's not her problem. That's not his problem. It's a we problem. We're trying to navigate this thing called sexuality in our romantic relationship. So certainly if both people think one person's the problem, that's usually not the healthiest place to start.
And something that I love, and I think you said this before too, and I want to kind of bring everybody's attention to, is really, I feel like sex just is an extension of a relationship. So I feel like if you already have a good relationship with your spouse, if you can already talk about any awkward thing that can happen between the two of you, or with a child, or with in-laws, if you're able to have good conversations, you are more likely to have good conversations about sex. On the other hand, if you don't get along, if you can't handle simple questions and simple issues, having a sexual issue or tension is just a continuation of the same spectrum. And I see that with my clients is, you shared with our group that sexless marriage, by definition, you want to talk a little bit about that?
Yeah, sexless marriage, how do they define it? It's less than 12 times a year, I think, is the definition of sex. I mean, of course, they have to define this so they can do research on it, right? It's like, this is just what somebody decided a sexless marriage was. So less than twice a month, I think, or, less than 12 times a year is defined as a sexless marriage. There, Dr. Barry McCarthy has amazing books, Rekindling Desire. I highly recommend it. But he kind of says, like, you kind of, stay in the habit of being sexual because it's just easier to kind of keep doing it than to like have a big absence and then try to jump into it again. So this is, again, just one person's recommendation, but at least every other week. Just because, when you play volleyball, you're better at playing volleyball if you play volleyball more than if you're like, hey, let's try this once every 6 months. You might be kind of clunky at it, right? So that's not to should anybody. It's just kind of like healthy habits of like, hey, you're better at playing, cribbage when you play cribbage a little bit more frequently. So that's just brains.
And I want you to maybe share with the audience what the percentage of that is, because I want to tell you, Kelly, I am so surprised by the number of people who have very little intimacy in their lives. Like I mean, I don't know what the normal number is. Like if you tell me this is the percentage, but I would think that because of the experience I've had, and I'm in a position where a lot of people share their stories with me, that how much more this is common. And then when they say it, there's this huge shame that they are the only one that have this experience. Like everybody in all the movies, everybody's in the mood, everybody, gets turned on without any foreplay and everybody's ready to go. And it's like, they're like, I'm not having this experience. So maybe talk about how common this is in our day-to-day life experience, especially like some of my listeners are mothers of young children, and how different seasons of life really changes our time and attitudes about sexuality, but also how you're not the only person having this issue.
Yeah, I mean, off the top of my head, again, I have to go look this up for like true facts on sexless marriage, but I think it's right around 10%. So it's not small. It's pretty, I'd say 10% is pretty common, right? 1 in 10 couples. 70% of couples hit rocky road patches with their sexuality after having a baby, 70% within the first year. Most, the stereotypical is like, 6 weeks after a baby, you get your gyne check. Yep, you're good to go. Do whatever you want. Most women are not comfortable having sex. They still have issues sexually 6 weeks after. That's actually remarkably quick after having a baby to have everything fully functioning again, especially if you're breastfeeding. Hormones are completely there to breastfeed, right? Not to enjoy your sexuality. And just normalizing that, because again, then the man will make it mean she doesn't love me anymore. She's totally changed. And then we take it into the future, and this is how it's going to be forever, right? Instead of like, this is where we are right now. I'm curious about this. I wonder if this is common. I wonder what else we can do to feel close to each other, like go on a coffee date during the day. But the curiosity is, I think, always the right answer. When we perseverate into the future, or we make it mean something about ourselves, it usually doesn't go well. And the other thing that you brought up is long-term relationships, right? So like what Hollywood is, what all of country music is, what all music is hot, spontaneous desire. And that is that honeymoon phase that happens to us all. It's akin to taking cocaine as far as the release of dopamine in our brain. Like we're literally stupid about other things because we're just thinking about this person all the time. It's like an infatuation. Our brain decides it can't survive that way forever, right? So as you get familiar with things, our brain's like, oh, well, hey, maybe I should, focus on my job and get some food and like not neglect the kids and, go take care, remember to exercise, right? So our brain kind of habituates to that person over time. Depending upon what study you read, 6 to 18 months is when that spontaneous hot desire kind of simmers into, I know this person now. They don't excite me every single time I get a text message like they used to. The dopamine isn't as high anymore. That's totally normal. Heaven forbid all those people out there who think they fall out of love every time that happens. You're not falling out of love. You're just kind of coming down from that high. that our brain gives us, because inevitably our population needed to reproduce, right? So like we got this high from a new novel person. But so normalizing for people to know that as we get in, and let alone 20-year marriages, 10-year marriages, right? Like you don't have that spontaneous dopamine anymore. That's fine. You're not broken. But you have to be intentional. And how you talk about being intentional of, hey, I want our relationship to include sexuality. Let's talk about it. Let's prioritize it. Let's see what works for the relationship, not just for one person or the other person, but for the relationship.
That is so good.
That was a lot to unpack.
No, but I actually really love that, because I think it's normalizing it, right? It's like, listen, it's like anything else is like, what do you want? Like, what is it that you really want to have? And you talk about shame and blame a lot. We both, Kelly is a life coach as well as a urologist, as well as an extremely successful and popular podcast, which I really recommend those of you who are listening to this episode on my podcast, check out her podcast. You would love it. And I want to say that one of the things that we talk about is processing our emotions. I asked you, what are the things that you will offer your patients or clients that may have questions about their sexuality? And now the first step is awareness, right? Like, where do we go with this awareness? So we talk a lot and we teach a lot about people processing their emotions. And as physicians specifically, we have no idea. Like I ask my clients sometimes, so, okay, this thought, what does it make you feel? And people are like, I don't know. And then instead of telling you what makes you feel, they give another thought. Like we were so removed from our emotional experience that we're just like, some people don't even know how to feel. So what I started doing, Kelly, and I think I'd love to share this with you, is that there's so many different wheels of emotions, and hot feel, and or how does it feel? What does it weight? And in mindfulness, because I did my training in mindfulness years ago, they talk about an open feeling and a closed feeling. So
yes, I love it. I love it.
Because if you think about a feeling, like you don't even know, like what is like clustered, flustered, what is overwhelmed, what is a lot of these feelings, if you just couldn't even name it, if you could just tell in your body, is this an open feeling or is this a closed? And what I love about curiosity, because I always say on this podcast, those people who listen, is like, curiosity is the opposite of judgment. If you're curious, and curiosity and connection and, compassion and clarity, these are like all open feeling. So if you have an open feeling, even if your sex life isn't great, you're still bound to figure things out as you go along. Whereas if you have a closed feeling, like, this is my problem and I'm ashamed, what's going on with my body? Why doesn't my husband have an erection? Like, if you have a closed feeling, you're just not going to go anywhere with it. So how will you teach this to men that maybe are not very good at expressing their thoughts? Like, what are ways that you can, teach the audience who's listening? How do you suggest that they structure up these conversations?
Yeah, I mean, we live in our heads so much, right? And I think just, before we get to that question, because I got to figure out how to answer it, the less we're in our body, orgasm and pleasure and, fun, nice, warm, bubbly sexual feelings in our pelvis, those are body sensations, body experiences. And the more we can, people always say drop into, and I was a snowboarder growing up. So I was thinking of like dropping into a half pipe for all of you Hawaii listeners who have no snow, but like dropping into, like it's this leap down, but really learning about your body and being it's all part of the journey of embracing that sexuality, right? Because I always say, you can't frontal lobe an orgasm. You can't think an orgasm. It really has to be experienced. And in doing that, the brain has to shut off the thinking parts of it. So you can't plan, you can't think of the past, you can't be in the future when you're in your body and in an orgasmic experience. Those other parts literally shut off. And that's where mindfulness and sexuality really are intertwined. Is we know meditation, we know mindfulness. Some people don't like the word mindfulness, a presence of just being, of getting rid of the future and the past, which is very meditative, but also that's really where orgasm lives. Orgasm doesn't live anywhere else. So that's super cool stuff. I love what you said about the opposite of judgment, and really, like, in so many relationships, again, I'm stereotyping the relationships, but it's just thinking the other person has to be fixed and that you're fine. The other problem is just thinking you're totally not fine, right? And all of that is judgment. And just realizing, like, is that, and I love that open feeling, because I think that's where love is, right? So many people describe love as an opening, as being available, and as not being closed off. And it's like, ultimately, what do you want in your relationship? Right? Is sexuality part of it? And if it is, how are you going to welcome that? I love the term, like, how are you going to be the person worth having sex with? Right? Are you opening? Are you accepting of that other person? Are you willing to hear that other person, being a good listener? So not just saying, like, sex is a job because you're married, right? But it's an experience to be shared with somebody. Again, it was all that intimacy, right? Mm-hmm. We're so ill-prepared to go into long-term relationships. We really are. We don't get any teaching on this.
And also, I think what we don't do, and I think this comes up in sexuality so much, is like, I deserve a good sex life. And there's an entitlement to that.
Oh, there's so much entitlement. I deserve just to have spontaneous sexual desire, and I'm not going to do anything. I'm not going to do anything for it, though. I just deserve to have my wife sleep with me all the time. I see that. It's like, really? It's not how it works. That's not sexy. I'll tell you that much.
Yeah. So I think that's what I wanted to say, is that, you can say I deserve something with two different thoughts, right? Like, I can say I deserve to get flowers every day, right? Like, I can say that, and I can go get myself flowers, because guess why? Because I deserve flowers. Or I can say I deserve flowers, and why isn't my husband getting me flowers? It's like, just because I deserve something or I want that in my life, whose ownership is it to have that? So I sort of think about sexuality when you came on to our group and talking about it, is that how it's like, you need to take ownership. Like, if you want to be somebody, I think, like you said, like sexuality, I love what you just talked about, the inner body experience, because, I did a workshop on worrying, and I was telling people that the second you worry, the second you have a thought of anxiety or worry, you have to turn that into inner body awareness. And what I mean by that is, like, people don't know what meditation is. Most people don't want to meditate. It sounds like this random thing that nobody wants to do, but it's impossible if you tap into your body awareness and then hold on to that thought. So if you're worried about something, and all of a sudden you're like, okay, I notice the worry, I'm going to tap into my body awareness. And that could be feeling your feet grounded on the floor, or feeling your hands and tapping your fingers on your lap, just the inner body awareness. And I love how you said sexuality, like, you cannot have an orgasm with your brain. It's like, you have to let go of the thought to tap into your body. So it is 100% mindfulness.
Yeah. And really, I think so many people take a passive route on, like, oh, I just have anxiety, instead of realizing, like, there's a lot of great tools to work with, live with, accept, or move on from anxiety. But there's so much data saying anxiety kills sex drive. Anxiety kills the ability to have an orgasm. They're not bedfellows. So if you are a person who tends towards anxiety or has a lot of anxiety, actually using that as, like, this might be a tool I can work with to help decrease the power that anxiety has over these other aspects in my life.
That is actually fascinating. So what do you do if you notice that? Because people don't come and say, I have anxiety around sex. I mean, do they come and actually say that to you?
I think it's more anxiety just in general in life. Mm-hmm. Right. So I'm anxious about X, Y, and Z, or the future. Somebody said, like, anxiety is just worrying about the future. Mm-hmm. Right. It's just like being and not being present, which I think is just reflecting what you said. So a lot of anxiety is just like people, they take it inside, they internalize it. I have anxiety. I'm a person with anxiety. I think saying, well, anxiety it's actually quite useful evolutionarily to have a little bit of anxiety. We let it run amok and control our entire life, and it is no longer useful at that point. And certainly it's not good if you want sexuality in your life.
Yeah. And also, talking about anxiety and sexuality, the idea of how you said anxiety is our thoughts about our future, thinking about performance anxiety, like for men, right? Like they have to quote unquote have a performance, whereas a woman, do they have performance anxiety? What does that even mean? So talk a little bit about that, maybe the anxiety of performance anxiety for women, performance anxiety in men when it comes to sexuality.
Yeah. Well, I mean, the first thing again to back up is like, what is sexuality? In its physical form, it's adult play, right? And when you put a lot of rules or conditions or worry on playing, the playing itself gets affected. And we know that anxiety and really affects erectile function, right? So is this going to work? Is it going to last long enough? Is it big enough? Is it hard? All of that worry and anxiety, the erection's like, I'm out. You are not going to enjoy me. I'm out. Then you get more anxiety because now you've maybe had a failure in the bedroom, right? And so it can kind of build on itself. Like, this didn't work last time. Is it going to work this time? So then once you can kind of get into this habitual loop and really taking a step back and being like, I need to trust my body to work again. I need to trust that it's going to do what it does. And if my erection fails in the middle of this sexual activity, it's okay. It's okay that it does that. Sometimes erections just go away in the middle of sexual activity, and it's okay. So really taking that strict performance criteria out of the activity. Sometimes we're going to have an orgasm and sometimes we're not, and that's okay. And just allowing, hey, we're doing some adult play together. It might go this way, it might go that way, but not all sexual experiences need to be perfect. And a lot of people don't know that.
That is a huge lesson, because I think a lot of people, when they think about performance anxiety, they're thinking of, having an erection, maintaining an erection, having a quote unquote successful sexual intercourse. But really, I love the idea of an adult play, because a play is fun because it's a play. And if you have more rules and, more condition of what a performance needs to be, then it no longer is play and it no longer is fun. So actually leaning into, what am I thinking? What am I anxious about? Like, if the play will be fun, no matter what's the anxiety doing there?
Yep. And it's also the role for non-judgment, right? Like, hey, honey, I'm really worried that this might work or might not work today. Can we have a backup plan for, like, just in case it fails? Because I still want, to know that you have a good time. What can we do instead? It takes all the pressure off, because men do have, I mean, our bodies are different. They do have kind of more that automatic light switch. We say it's automatic, and then when it doesn't work, it's devastating. It's actually quite common.
I love that. I just love the way you're talking about it. I think normalizing this conversation and accepting each, like, awareness, like, I feel like the whole experience of life coaching is like awareness, acceptance, and acknowledgement, right? Once you've done that little loop of, I am aware that it's happening, I accept myself with my limitation or your limitation, I accept you the way you are, and I acknowledge that if it should happen, what are we going to do about it? Like, it's like, have a plan. Like, I talk to people about having anything that happens in our life, there's a trigger and a response, and the whole personal development, the whole psychology of human existence is creating space between the trigger and the response. And in sexuality, the trigger may be, oh, we didn't have what I had in mind about our sexual interaction. Now, where do we go from here? And creating that space is having that open dialogue. And I just love the way you talk about all of it and how you normalize it all.
So good. Thank you. I want to bring back that intentionality and living life intentional. I just want people to hear a little bit more of your zone of genius there, of like, we've been living our life doing what we thought we should be doing. And then I think for a lot of your people, it's a health scare, right? And they kind of maybe get it snapped into them of like, holy moly, what have I been doing? Right. And it's like living life on purpose. And your whole point is like, hey, maybe we could back up and like figure out how to live intentionally even before a healthcare scare happens. Can you talk a little bit more about intentional living and how you see people do that well?
100%. I feel like, listen, we have this one life, and anytime that you're struggling with anything, and all the listeners right now, whatever is really ailing them, I always say, just hold on to that. I'm going to run to the hospital and drag 16 people that would immediately change spots with you right this moment. I think I have the 30,000 foot perspective. Like, people who work with me, they like what I do or what I say, because my position as someone that has this clarity and perspective of being close to death right now, like that, really enhances your living experience. Like nothing. Like, you want to lose 5 pounds? If I can show you people who are struggling with keeping, food down so that they can qualify for chemotherapy, it puts change into all the things that are upsetting us. And it goes back to what you said, and it goes back to mindfulness. If you are somebody that's just constantly thinking back, oh, I should have done this, I shouldn't have done that, I should have done this earlier, I should have done that later. If you're constantly living your current moment experience, doing something that you didn't do in the past, or worry about what's coming, you're like literally are not making friends with your life. You're not making friends with this very moment. And if you can't have any kind of agency over this minute, the very minute that you're living right now, you've lost your life before you get sick.
Yep, totally.
And one of my favorite saying is from Shawshank Redemption, where it says, get busy living or get busy dying. Because listen, no matter what we are doing, this number line, those of you who have little kids, life is like that. And I will tell you, no matter how old you are, I'm 52 years old, I still have the rest of my life ahead of me. How is this rest of my life going to look like? Like right now, Kelly, I want to be doing absolutely nothing other than being with you, listening to you, and talking to you. This is the best way I can use my time, and I want to be nowhere else. That's sort of being intentional. And I say, we do different things. We talk about intentional eating, intentional time and clutter management, intentional, relationships. But what it all comes down to is we are constantly doing and doing and doing and doing. We constantly talk about being more productive. What do you do with your time? But I always say, we are human beings. We're not human doings. So if you could pivot and say, I want to be a good mom. I want to be a good mom, not 17 things I did for my kids, but I want to be a good mom. And you can be a good mom by doing nothing for your child. That sounds crazy, but you can just tap into that. Lean into this very moment. Just live this moment. Live no more minutes at all. Just live this moment every single day with the highest octane that you can possibly live. And you have the most amazing life, no matter how many days you have ahead of you, whether you're seriously ill or not. So I will share with the audience that I do pro bono coaching for people with serious illness. And I remember one client specifically sticks out in my mind. He had a devastating lung disease. And essentially he was saying that I'm really worried that this is my lung disease that's progressing and I'm getting closer to the end, or I'm not sure if this is a pneumonia. And I asked him, I said, which one would you rather believe? Because I don't know which one is creating more drama in his mind. And he said, well, I'd rather this be a pneumonia. I said, okay, it's a pneumonia then. Like, we can choose a thought that creates less suffering. So I always say, death is certain. Suffering is optional. So you get to decide whether you have a bad disease. Like, let's say I have a terrible diagnosis right now that I'm going to have 6 months. I'm not dying right now. Like right this minute, I'm not dying. I'll die 6 months from now. So if you could live every minute to its full capacity, regardless of what diagnosis you have, your life experience will improve instantly, regardless of your disease.
I love it. Absolutely. What's the role of gratitude?
So I love that so much that you mentioned that. I feel like gratitude is what's going to center you. And I will share this with you. So we all, I mean, I don't know how much of this you share with your audience, but the idea of having daily, like looking at your mind, putting your mind thoughts down and fact checking everything you say about yourself, part of your journaling, right? Just like, what are you thinking? Having awareness, like having awareness is all about having awareness. But you can start your day, if you're somebody who journals and meditates in the morning, and you can feel pretty good. By 3 o'clock, your brain will have the same thing that you have at 3 o'clock when you're at work and you want to go to a vending machine and you want to have a pick me up. Because the idea of awareness actually goes down. Like if you are not constantly replenishing that, it goes down. I have a literally 3 o'clock reminder on my phone. And it's funny because we have a family plan. So all my husband and the girls get it too. They're like, Mom, it's a 3 p.m. reminder. And the 3 p.m. reminder says, what was great today? And the reason that is so powerful is that you may just think, oh my God, Groundhog Day, it's just one more day. Like, what did I do today? And if you can midway catch yourself and say, well, you know what? I responded to these 3 emails I've been avoiding, or I gather this, or I do that, because your body, your naturally tendencies to beat yourself up. Like we have like 80% of what we think every day is identical to what we thought the day before. And 90% of it is a negative thought. So we actively are swimming against all these negative judgments and thoughts that are coming up about ourselves. So if you could catch yourself midday and find midday gratitude about, hey, Faryal, today wasn't a bad day. You did this and this and this. I have to tell you, the rest of your day will go well no matter what.
Love it. That is a great, simple thing to incorporate that doesn't take any extra time. I love it.
Well, thank you so much. I want to be respectful of your time because I know you are jumping off because you're going to something else, but I have to ask you this question because I ask everybody on my podcast.
Oh, yeah.
What's on your bucket list, Kelly?
I don't know. I know you won't judge me. Truthfully, I think I've done so much work to enjoy life now that I truly know that this is the life I'm supposed to be living. So, I believe so strongly that there's no there, that like, there's not anything. I mean, simple stuff like I'd like to check out Spain someday, but like, this is the life I'm supposed to be living. There's nothing. Does that, I'm not being eloquent, but yeah.
No, I love this so much because I have to tell you, it's funny because somebody asked me, because I always ask this question from someone, and somebody asked me, and I never thought that someone might ask me that question. And I actually said, I don't have anything. I have a reverse bucket list. Like I want less things every day. Like it'd be nice. Like you said, Spain, it'd be nice, but do I have to do it? I don't know. I could care less, but no, I love that. And I certainly wouldn't judge you. It's a curious question, but I'm always wondering, because the reason I ask this question is like, living intentionally means living in a way that you don't have things on your bucket list.
Yeah, I mean, I have things in my future that I want to do, but I know I'm going to do them. They're not really like a bucket list. Like I don't have to do them either. That's the other thing, is I don't have to do them. It's okay. They're just kind of ideas that I have. But truthfully, I'm like, I think this moment is so stinking good that I just want this moment now until the end, knowing that I'm going to have great next future moments. I don't know what they are, but like, there's nothing wrong with where I am. It's so beautiful. I'm so blessed to be here.
Love it so much. Thank you so much, Kelly. It was so
This
much
was such
fun.
a good talk. Thank you, my love.
I had a wonderful time. I can't wait to see you very soon, in a month or two. Yeah.
Yeah, we're going to see each other very soon.
I love that. Thanks, Kelly.
Thank you.